Bismillah, alhamdulillah, wassalatu wassalamu ala Rasulullah. So coming back to recording after quite a few weeks, we're very busy in that. But I want to address the difference between reactive airway disease as well as asthma. So many parents are confused that whether my child has asthma or not. So you should remember that babies after birth till they are like up to 10 years of age, even 10 years, they have some kind of allergic reaction which leads to having cough, difficulty in breathing, etc. So parents may be nervous what's going on. So we consider the non-specific diagnosis of reactive airway disease. So, but what is the asthma? Asthma is the very specific variant of it of reactive airway disease, and we really take time to label it as asthma. So, the passage of time from reactive airway disease, the kids come out of it and they get better as the time passes. And the associated eczema is also treated, and the patient has no problem in the long run. But sometimes these patients they can have prolonged symptoms even in their teens and adult life, and here we can label these patients as asthma. But very specific thing is that this patient should be diagnosed on spirometry. So whatever spirometry tells us like asthma, what we should consider is asthma. So for the non-reactive disease, reactive airway disease, what we do is very kind of symptomatic treatment. That if a patient has a lung infection, we give the antibiotics. If there are viruses causing this, we try to like manage on oxygen and to make sure the airways are patent and they are doing fine. But with passage of time, as reactive airways grow up, it goes down, and then whatever is less, we call it asthma. So as I mentioned earlier, to label them, we should have spirometry done. But I can tell you some protection which you should do during reactive airway disease and asthma. So always remember, try to find out which thing or stimulant causes this reactive airway disease or asthma. And you should remember that. For example, people have birds in their home and they have their droplets and the antigens, they cause the problem in little babies, so we have to remove that. Some people they have dust mite, so we have to make sure that they don't have like mats and they're clean of dust mite. Similarly, people can have other things like paint or certain things which can cause this reactive problem, and we can remove that. But sometimes what happens if we're not sure which kind of allergen or thing is causing reactive airway disease or asthma, so what should we do with that? So what we can do is we can refer them to allergy specialists. So what they do is they make cuts on your skin in multiple times, multiple places, and then they inject or keep these allergens of different names and see which are the person reactive to. So whatever the person is reactive to, those patients are told that they should not come in contact with this particular substance. And there are many claimed treatments, many of which may not be effective, but for asthma, usually it is that we want to start ventilating for this patient so that it can open the airways, and sometimes we may use steroids to decrease inflammation along with oxygen and make sure that the oxygen is delivered to the body. And after that, in the long run, we want to make sure that they are not only on Ventolin, but they should also have long-term inhalatory steroid. That's his second choice. Really, in our country, they don't do that. It's very important that patient has problem consistently. You should go to the next step. Although you don't have reaction to anything, still you should start with the inhalatory steroids, which you can be taught how to use it. If the patient doesn't do that, even it doesn't control him on this problem, then we can go to the further step. So usually what happens if we use prolonged uh, beta agonists along with steroid, and if the patient is not under control, then we can go to the next level. That is, we can use montelukast, so they modify the receptors on the cells. So because it's a chronic long process, so many people they are not compliant. And what happens is when they're teenager, they don't care, they don't listen to the parents. Ultimately, start missing the doses, And when patients started missing the doses, they can go into exacerbation. And then sometimes it can be very hard to treat the patient. Even so, and so the patient can go on ventilator because poor patient cannot breathe him or herself. And many people can expire on the ventilator, or they can expire even on the way to the ventilator. So my request is that you should go to your doctor, whether he or she has reactive airway disease or they have asthma. Thank you.